Health Break is sponsored by Dignity Health Central Coast.
Ankle sprains are one of the most common injuries in sports and in day-to-day life. Foot and ankle surgeon Dr. Byron Collier explains what happens when you sprain an ankle multiple times.
Whether you roll it in or roll it out, then you're causing strain to the ligaments, which are basically the tethers that hold the joint together. And repetitive strain, when it happens over and over again, then can lead to chronic stretching or even chronic tears in these ligaments and cause instability that can be debilitating.
This type of instability may need treatment that is more extensive than rest, ice, and elevation.
With a simple chronic ankle instability, typically we can just tighten up the ligaments that are there. We take a look at the inside of the ankle and clean up any scar tissue or fibrous bands that have formed. We can do a lot of that purely through the arthroscopic approach. And so that makes for smaller incisions, makes for less pain and quicker return to activity. A lot of patients, even with significant ankle instability, can undergo a surgical repair and get back to at least moving the ankle by 3 weeks. The success rate of these procedures is excellent, and it's been excellent for a long time.
Talk to your doctor about treatment for ankle instability. If you don't have a doctor, call 833-758-3836 or visit dignityhealth.org/Central Coast. I'm Kristen Presall.
Health Break is sponsored by Dignity Health Central Coast.